So that's two reasons why we keep the blood sugar up above 70. But as a general rule, if you're at home using the best equipment we have available, which is the modern glucose meters, you can assume basically that if your blood sugar is 60 or 70, it doesn't matter whether it was 55 5 minutes ago, it's gone. There's nothing you can do. You just need to react and respond to it. But as a general rule, a well warmed up finger is as good as an intravenous test. Not quite, but close enough. Yes, sir.
We do toe. Is that any different from finger?
No, as long as it's warm. And some people have done earlobes. And there are off-site testing where you can do the arms. There is some thought that when you do off-site testing on the off the fingertips, that the blood flow in the arms is a little slower than when you get in the fingertips of the fingers, so that there is a little delay on that one. So some people will say if you do testing on the arm to avoid going into the fingers, that there is a delay, that the blood sugar you're measuring is what happened 5 minutes ago. But it's not worth worrying about that. You guys have got enough to worry about in your daily management without worrying about does this really reflect what's happening right now. But that might be, for example, a reason why if you give some IV dextrose or some dextrose through a G button and the blood sugar doesn't quite come up in 10 minutes, that you should keep checking it every few minutes to make sure it's coming up. Okay. All right. Let me see what the next question is.
I have several people.
You have several questions
that are asking on this.
Okay. Yeah. So read them out to me.
Okay. Carol Brown wants to know, HI, can sudden spasms develop even though your blood sugar is fine? I have another one that wants to know.
So hold on. We'll do one at a time.
Oh, okay.
So the question was, can spasms happen despite a normal blood sugar?
Yes, sir.
Okay. So really depends what you mean by spasms. So let's assume she means seizures. So if you have a child with hyperinsulinism and they've somehow or other been unfortunate and had some damage to their brain, they can get seizures as a result of that. So blood sugar can cause seizures to occur when the blood sugar is low, but it can also damage your brain. And if that area of damaged brain can then trigger seizures. So if you have a child with hyperinsulinism and they have a seizure, your first instinct has to be that this must be low at the time, so you check the blood sugar and you give sugar to get it up. However, if you've had low blood sugar seizures or you've sustained damage, you can then have epilepsy or seizures without having a low blood sugar. But you still sort of have to check your child every time because you can't tell on any given seizure. So the answer is you can have seizures with low blood sugars and seizures without low blood sugars. The seizures that occur with low blood sugars are rarely treated with seizure medication. The treatment is to get the blood sugar up. The seizures that occur without low blood sugars usually need anti-seizure medication.
Okay. She also wants to know, here in America, our blood sugar is 70. So on a meter in the UK, is that 1 point? What is 70 in the UK?
So the question is, what is the conversion from milligrams per deciliter to millimoles per liter? And the answer is, it's technically 18, but for convenience we use 20 because it's easy to do the math. So for example, a 70 would be 3.5, a 40 would be 2. So just divide by 20 if you're listening to me in the UK and you want to know what that is in millimoles. But as a general rule, the cutoffs in millimoles are, you don't want your blood sugar to go below about 2.5 millimolar, that's about 50, and you want to keep it above 3.3 to 3.5 most of the time.
Okay. Adam wants to know, where did he go? Okay. Where are you at, Adam? Is there any development in a medicine that will help to control the sugar when you were talking about
sugar? Okay. So the next question is, are there any new medications out that will help glucose control? And the answer is, there's currently nothing new that is FDA approved. There are studies going on in Philadelphia looking at some new medications that are currently given intravenously but could be given subcutaneously, meaning injected under the skin. There is an interesting medicine that's a version of, it's similar to octreotide. It's being used for Cushing's disease, which is a tumor of the pituitary gland that secretes cortisol. And when they did the studies on this drug, they found that many of the patients got diabetes. So I don't know of anyone yet who's working on that drug in hyperinsulinism, but that's one of the next ones that we'll be starting to look at. Any questions?
Carol wants to know if there is research being carried out on stem cells to help with HI.
So the question is there any stem cell therapy being done to look at helping patients with hyperinsulinism? So there's two ways to answer that. One is that there are, to my knowledge, nobody is doing stem cell therapy to cure hyperinsulinism